Welcome to the monthly clinical meeting organized by the Sri Lanka College of Pediatricians. Minal, can you hear me?
Yes, Dr. Chandan.
Okay, thank you very much. So, as you know, our monthly clinical meetings now being conducted as virtual meetings because of this COVID situations. And with this appointment of a new council of the Sri Lanka College of Pediatricians, according to our new theme. So, mainly now we are focusing on the research to improve the research culture among pediatricians. We have started series of lectures, as you know, last one done by Professor Sachit Mittanandan. And today we have very special speaker, world-renowned speaker on these fields. As you all know, he is Professor Janaka de Silva. Professor Janaka de Silva is a senior professor and the chair of medicine at University of Kelaniya. He was formerly the Dean of Faculty of Medicine, University of Kelaniya, and most importantly, he worked as a Director of Postgraduate Institute of Medicine and University of the Colombo, and he was a Chairman of National Research Council and a member of the University Grant Commission also. Prof. De Silva holds degree from Colombo and University of Oxford, and he is editor emeritus of the Ceylon Medical Journal, and he is also former editor of the online appendix of Kumar and Clark Clinical Medicine, a well-known book. And he is currently deputy editor of the PLOS Neglected Tropical Diseases, and he has served on Committee on Health and Research organizations, including the WHO, Wellcome Trust, and National Institute of Health Research UK. And he's a recipient of the titular national honor, Vidya Jyoti. As you know, this is the country's highest award for science. So most importantly, he is very relevant to deliver this topic. He is a world-renowned researcher, acclaimed researcher with many publications in his field. So it lays pressure to have you, sir, and it's privilege, my pleasure and privilege to introduce you over to you, sir.
Thank you very much, Anna, and thank you for inviting me to deliver this lecture. I hope everyone can hear me.
Yes, sir. Yes, sir. We can hear you.
So my topic today is a very broad one, just to give you an overview of research in this country, why we should do research, how to start, and then very importantly, how to end a successful research project. So, as Chandra said, the research culture is not very widespread in Sri Lanka yet. And this is so even in some of our universities. But happily, there is some evidence of a positive change that is going on. Now, why this research culture was lacking or lagging behind most other middle-income countries was that local funding for research was not adequate in the past, especially before 2009. And then there was some increase over the past few years. And then, of course, COVID came. And once again, funding has more or less dried up. For those of whom who don't know, the usual funding for medical research can be obtained from the National Research Council, the National Science Foundation, and if you are a university academic, from the University Grants Commission, and also directly from the university that you work in. And this is just a graph to show you what I meant. On the green bars, you can see that the absolute value of R&D funding in this country increased from about 8 billion in 2010 to 15 billion in 2016. But it's the blue line that is important. And this is very disappointing because this shows R&D expenditure as a percentage of our GDP. And that is remaining stubbornly around 0.1%, which is very low compared to most countries that are in the middle income state, or in fact countries in our region. Now, the objective measurement of research and productivity and quality that an individual or an institution or a country as a whole does is measured commonly by publications and patents. And of the two, especially in the medical sciences, because we are not so much into medical technology, publications are the most widely used. And this shows that over the years, say over the last 25 years, from 1996 to 2020, there's been an almost tenfold increase, more than a tenfold increase in the number of all published scientific documents from this country. So there has been a rise, and the rise has been pretty steep from about 2010 onwards. So that is why I said there is grounds for hope. And that hope disappears slowly, because if you look at the total number of published scientific documents from Sri Lanka, which is about 3,000, and you look at the red square at the bottom of this graph now, you see the numbers that other countries publish. China, 780,000. India, 200,000. Malaysia, nearly 40,000. Thailand, nearly 20,000. So we do lag behind countries when it comes to the number of scientific documents that we put out in this country. But what we do publish seems to be of good quality, and that is measured by citations. And there is a measure called the field weighted citation index, which is a ratio of the citations received by a country's research output to the average number of citations received for global output. So for the world, it will be 1. And as you can see, anyone over 1 is better than anyone under 1. And we are one of the countries that has a field weighted citation index over 1. And this is data from 2017, and it is not a fluke, because even over the last 5 years, from 2013 to 2017, our field weighted citation index is higher than even India's. So although we do only little research in numbers, the quantity of research, what we do seems to be of relatively high quality. And happily for medics, more than 25% of the research output in publications from this country are from the medical sciences. You can see from this pie chart, more than 25% is from the medical sciences. And that is the number of publications that are indexed in Scopus. You go a little higher and look at the number of publications in journals over an impact factor of more than 1. Again, you can see that the medical dental sciences, the number of publications equal the sum of all other publications from the other sciences. So the medical sciences are doing well. So although we are not doing a lot of research as a country, and the quantity is low, the quality is high, and we as medics can be slightly happier than the rest, because we seem to be doing most of the research in science. But there's always a proviso. And if you look at the quality of what we do, you look at a qualitative assessment of Sri Lankan medical research, most medical research in Sri Lanka has been, and largely still is, small scale and descriptive. Saroj Jayasinghe in 2012 did a little study, and he showed that of the abstracts presented at the Sri Lanka Medical Association, which is our premier scientific meeting, less than 5% of the abstracts dealt with interventional studies. Most of them were just descriptive studies. And that was the same in 2011. And Ranasinghe and others in 2012 published this nice paper which shows that the type of article which has high citations, like systematic reviews, or randomized controlled trials accounted for less than 10% of our medical scientific output. Most of our studies, nearly 50%, were descriptive studies or case reports, which have a low citation rate. And I feel that is because of several weaknesses that we have. There's a lack of self-confidence in most of our researchers to undertake large-scale studies. There's also an aversion to multidisciplinary research teams. We try to work within ourselves and not join other departments, other universities, other faculties to make multidisciplinary research teams. And one of the other negative things is that some of us at least, view interventional studies like clinical trials as too difficult or even unethical. And I think this is especially true in pediatrics, where when you try to do clinical trials on children, there's a lot of questions regarding ethics brought up, which are unfounded. But there are a lot of strengths that we have, especially in medicine. We have a pool of highly trained doctors, many of whom are exposed to research at centers of excellence and who are convinced of the importance of research and are motivated to find solutions to local health issues. So we have strengths, although we seem to be quite slow in utilizing them. So why should we do research? Why should we do research as medical professionals? Like all professionals, medical professionals and academics fulfill a service function. That is, we see our patients or work in labs and so on. But we should also disseminate knowledge in the area of expertise. And that we do by teaching medical students, postgraduates, and so on. But in addition to disseminating knowledge, we should also try to generate new knowledge. And generating new knowledge is by research. And I feel that research is important for all doctors. All. Because doing research helps you to learn scientific method. That's the most valuable thing that you get from doing research. You learn scientific method. For example, my PhD was on the mucosal macrophages in inflammatory bowel disease. But I am doing research on snake bite, and that's because I learned scientific method while doing my PhD. You don't have to do a PhD to learn scientific method. Doing a good research project will help you learn scientific method. And if you learn scientific method, it enables you to read other people's research critically. You can read a paper and say, look, this is rubbish, or this seems to be a very well planned clinical trial with good methodology. So I'm going to change my practice according to the conclusions that have been reached in this paper. Because enabling reading other people's research critically assists you to make informed and evidence-based decisions, which will change your practice. And simply, this in turn will improve our performance, which is in patient care, so that we will be not giving useless medications for people who have some sort of illness. So how do you start a research project? How does a young researcher or a person interested in research, a young doctor, start a research project? Well, the first thing you have to do is you have to choose the area of your research. That is, you have to decide what is the problem to which I want to find an answer for. And that is easier said than done, because most of the time, these people are compelled to follow institutional and departmental priorities. For example, if you come to my department of medicine and want to do some good work on, say, respiratory medicine, I would probably tell you to go and work with a consultant in Venezuela, because we don't do a lot of respiratory research in my department. So when you join a department, the institutional and departmental priorities come to the fore, and you have to just fit into that. But sometimes your own choice may be allowed. You may be able to do research that you want to do, really, and not what the institution or department wants to do. However you choose this area of research, whether it's institutional or your own choice, the two most important questions to answer when you formulate this research question in your mind are, is what I am doing relevant? Is the research I am going to do relevant to my city, my country, my region, or the world? The second important question is it feasible? Do I have the expertise around me to do this study? Do I have the resources around me to do this study? Remember, we are in a lower middle income country. And therefore, the research strategy for a medical scientist working in a country like ours should be that we should learn to adapt to research in a resource-poor setting. You have to be realistic. You shouldn't try to compete with the West to do genetic studies, the basic sciences, because you can never beat them, because they have so much more resources than us. So it would be realistic to focus on problems that are relevant locally, but are rare in the West. For example, snake bite. No one can do snake bite in the UK without working with us. And then you seek foreign collaboration where necessary. That is also an adaptation to research in a research process. And having said all this, I want our young doctors to have confidence to do interventional studies, not just describing a problem all the time, but actually answering a question of what do I do with this problem? How do I solve this problem? Once you have decided on an area of research that you want to work on, the most important thing, and this is a very important take-home message from this lecture, you have to acquire a wide knowledge regarding the chosen area of research. You must never get into doing a research project without acquiring knowledge regarding that area of research. And there are lots of ways you can do it now. You can do literature reviews on paper, you can get references, papers, recent reviews, and then of course there are CD-ROM systems, internet search engines, far easier than it was to do research than our predecessors who did not have internet or CD-ROM systems. Now, when you do a literature survey like this, collecting about 200 papers on that area sometimes becomes a bit overwhelming. And what you can do to focus down on the area of research, to get the points that are really important for you, is to write a well-referenced essay on the topic based on your literature survey. For those who are doing thesis, this essay becomes the introductory chapter. For those who are just writing a paper, this review of the literature becomes the introduction and part of the discussion. So it's a very useful thing to do this. And doing this kind of literature survey and writing an essay like this helps you to acquire all historical data, all the past work done on this area of research, so you are not unnecessarily repeating the same thing. It also helps you to identify unanswered questions in that area, and then among those unanswered questions, decide what you think can be researched, remembering relevance and feasibility. And then develop the hypothesis or the objectives of the study. And then, of course, comes the hard part. You have to now develop a detailed research plan. And it is, I think, wise in this early time of starting a research project to get advice and opinions from your supervisors, other relevant experts like statisticians and senior colleagues. Don't wait till the end, because once you talk to these people, the plan that you have may have to be abandoned. So you start to develop a detailed research plan with the advice and opinion of supervisors and so on early on in the development of the research plan. And like for most of us, don't forget the time factor, because if you are a postgraduate student, you may have to do this research in a limited amount of time. You must discuss all the details of your research plan. You must discuss the objectives, which should be clear and as few as possible. If you are planning a research project which has 15 objectives, that's going to end up very badly for you, because few such research projects end up in publications. So you should have few clear objectives for your research. You must discuss all aspects of methodology. The type of study, is it retrospective or prospective? Is it an epidemiological study or is it a clinical trial? What is the population? Is it a hospital-based study or a community-based study? Are you taking all patients who attend the clinic, or are you going to randomize these patients and take only a random sample? If you are using lab tests and medications, details of all of them, doses, routes of administration, all of that has to be discussed when you are making the research plan. And then the statistician, a very important person in the development of the research plan, who will help you with important things, for example, the sample size. You don't want to do a big trial for some reviewer to say, oh, the sample was so small that your results are not valid at the end of your trial. So sample size. What test to use in the analysis of results. All of these have to be decided a priori or before you start the project. And when you are discussing all this, don't forget to discuss ethics, because all research, medical research especially, must conform to accepted ethical standards. And you must also not forget the importance of the budget. How much is this going to cost? And a detailed breakdown of expenses should be made so that you know how much money you need to conduct this research project. And funding is very important, because quality research is usually not possible without proper funding. You may be able to do little research projects during your PG training or whatever, but quality research is usually not possible without proper funding. So what you do there is to learn to write a very convincing grant proposal. A grant proposal that will convince people reading it at the National Research Council, for example, to say, look, this seems a good study. I think we have to fund this. And what you do is you learn to convert your research plan that I was discussing previously into a good grant proposal. And if you have done the literature survey, and if you have discussed all your research plan with experts, then your grant proposal is going to be good. And here again, I want to remind you that ethics approval is a prerequisite to receive funds from reputed funding agencies. And then, of course, you get on with your research. And what do you do at the end of doing research. You have to disseminate your research findings. That's what you have to do. There's no point in doing research and putting it in a file and keeping it in your drawer. You have to disseminate what you have found, whether it's positive or negative. So how do you disseminate research findings? Research findings are not disseminated by talking at parties and meetings and saying, my unpublished work shows this and that. So no publication is not an option. A presentation at a small clinical meeting without a published abstract also doesn't work. That's also, or that should not be an option. A presentation at a good meeting with an abstract that is published may be acceptable, but I don't think you should stop there. And the objective of disseminating research findings should be a journal publication as an original article. Then, of course, comes the point, there are lots of journals, many types of journals. There are journals that have no peer review. Those are journals that are started by departments or universities, very poor quality. And then there are these predatory journals, journals which email you and ask you to submit papers to them, for which you have to pay. And to help researchers, some universities in our country have produced a list of white journals that are journals which are clearly not predatory. The other thing you can do is there on the websites you can find lists of these predatory journals. So what you should aim for is to publish in peer-reviewed journals that are published regularly. But remember that some of these can also be predatory, because unfortunately some of our scientists, including medical scientists, because it's so easy to get what they have done published in these rubbish journals, would send their work to them. So these predatory journals also publish quite frequently. So the safety valve is to try to publish your article in an index journal, a journal that is included in a widely recognized scientific database, because those databases will make sure that the journals that are there on their databases are not predatory. And these include Science Citation Index Expanded, Scopus, PubMed, and for those who do a little bit of medical research that incorporates social sciences, the Social Science Citation Index, Arts and Humanities Citation Index, and so on. So you should try to publish your work as an original article in an index journal. That should be the least that you should try to achieve. So, ladies and gentlemen, if I may summarize what I have been saying, I feel that research is important for all doctors, and I hope I have convinced you of that. And when we are doing medical research, I think we need a paradigm shift from doing descriptive research to interventional research, especially when we are doing clinical research as clinicians. You must remember that high quality research needs careful preparation, attention to detail, commitment, and funding. Please remember that. A lot of people who come to me say, sir, this research project seems to be a little too tough for me. And I always say, good research is not easy. Remember this. And then once you finish your research, publication of your findings as an original article in an index journal, or if you have done some biotechnological research, obtaining a patent, either of these is a good indicator of the quality of your research. Thank you. That's it, Janaka.
Thank you very much, sir. Thank you very much. And I'm sure all of our attendees got a very comprehensive insight about the research, especially some motivations about research, how to start, why should we do research, why should we start research, and especially do good quality research. And it's very important that even our Sri Lankans, the number of researchers are less in comparison to the rest of the world. It's very happy that sir has highlighted that field weighted citation index is more than one in Sri Lanka. It's a very good thing. And we have, if you have any questions, our participants can send these questions to the chat options. You can see there's an icon in your right hand side, the lower corner of the right hand side. So I just want to ask, as you worked as a chairman of the National Research Council. As you mentioned, one thing is the lack of funding for researchers. So for our budding researchers, what are the available this funding sources in Sri Lanka? Or how should they apply to these research grants?
So the main national grant awarding agencies in Sri Lanka for medical research are the National Research Council and the National Science Foundation. Of course, if you are working in the university may have a limited amount of funds for research, and also the University Grants Commission. These agencies, Chanda, the NSF and NRC, regularly put out advertisements calling for research grants. I think they do it annually. At least the NRC does it annually. And then you have to apply with your proposal. And then it goes through a peer review, and it's very competitive because we have little money to spread around. And but medical research gets a lot of funding from the NRC and the NSF.
Thank you, sir. Yeah, we have one question, so that don't we need to initiate this form of medical facilities? So just
yeah. So I think
Yeah.
whoever this person is asking the question is, should we initiate the research culture early on? And I think we
Yes, sir.
are.
Yeah.
Almost all faculties in the country now have student research projects. I know that in Ragama and in Colombo, for example, we have a student research conference during their 4th year where they do research projects and make poster presentations. So I think that's the kind of thing that has changed the culture. When I was a student, we didn't do any research with medical students. Now almost all medical faculties, the established ones at least, have a research module that students have to undertake to make them learn how to do research. And then in the PGIM also, we have every MD program has a research component. So I think what this person is Naomi, I think what you say is happening now.
Thank you, sir. Yeah, and what is this? Our College of Pediatricians also trying to do this, do some sort of motivations for our trainees as well as pediatricians to start researchers. That's why we are organizing these presentations as well with world-renowned researchers, especially some sort of assets of our country. So as there are no other questions, so this is usually this happens. Still, this culture is developing. So I hope that this is also given some sort of motivations to do research, and these presentations will be uploaded to Sri Lanka College of Pediatricians website, and later also our trainees consultants go through this presentation. So it's the time to conclude our monthly clinical presentations to this month. So I would like to thank Professor Janaka de Silva, agreed to do this, doing very good presentations, making aware some sort of eye-opener to our pediatricians, trainees, and all the participants to do some good quality research. Even the number is less, we can do very good quality research and international research. So thank you very much, sir, with your all the busy schedules, allocating some time to educate our attendees as well as the members of the Sri Lanka College of Pediatricians. And I would like
It was
to
a pleasure, Chandra.
thank you, sir. I would like to thanks our participants. So this is 12 p.m. With some works also, because this is the usual time we did this the monthly clinical meetings as a physical meeting. So we continue with the same time, and this will be available in our website as well. So I would like to thank all participants, as well as finally GSK, always providing this WebEx platform and giving the technical supports as usual throughout this endeavor. We just started 1 year ago with doing this online virtual presentation. Since then they are supporting. So thank you very much. And next month also we would like to plan to another topic especially related to researchers. So thank you all of you. Have a nice day. Thank you very much.
Thank you.
Thank you, sir.